Thank you for visiting Medicare on Video. I'm Keith Armbrecht, founder of Medicare on Video, and I help people across the country make the right Medicare choices, and I can absolutely help you as well. One of the best parts about what I do is there's no cost to you to allow me to help you. So hopefully you'll take advantage of everything that I can do to make sure you get your pieces in the right places. And right now I'm going to talk about Medicare Supplement Plan N. And if you do have any questions after the video, feel free to send me an email or give me a call. I'm happy to help with any of the questions. So right now we're going to get into Plan N. We're going to try and get it done in less than 3 minutes. So let's go ahead and get started. So Plan N is absolutely one of the choices that you will consider when you're looking at Medicare supplement plans. And Plan N generally will have a lower premium, which can equate to more savings. So it all depends on where it falls and which part of the country you might be in. But that's what I do, is I help you figure out which plan is the best value, not necessarily lowest cost, but the best value overall for you to go forward in your healthcare needs now and in the future. So when you look at Plan N, you can see Plan N has a lot of check marks. So it covers a lot of what original Medicare does not. What it does not cover is Medicare Part B deductible, just like Plan G. And then Medicare Plan N also does not cover excess charges. I'm going to go over that in just a second, explain that to you so you understand. And then it has some additional co-pays as well. So that's what brings the premium down, is there's a little more out-of-pocket expense to it. But again, if the premium justifies it, it's absolutely worthwhile to consider. So when you look at the cost for Plan N, what your monthly cost will be is, number one, the premium. So whatever it costs for Plan N in your area, and it's generally less than $100 a month, can be as low as $70 a month, just depends on where you live. And that's what we do, is we get those prices for you as well. You have your Part B deductible, which right now is $198, runs January to January. You first have the $198 deductible, and then you will have co-payments under Plan N, where if you go to the doctor or the emergency room, and there are possible excess charges. I'm going to get into that right now and show you exactly what that entails. And again, if you have any questions, just send me an email or give me a call. I'm happy to help with it. So co-payments fall into kind of two categories. If you go to the doctor, it's going to be a $20 copayment, and it's really up to $20, so it's not always $20, but the maximum is $20. And if you go to the emergency room, it's a maximum of $50. So if you're admitted to the hospital, they waive that. But those are your co-payments. And again, they're not outrageous. So if the premium is low enough, makes sense to have some co-pays. And then we have excess charges. This is kind of a gray area in Medicare. So certainly something to understand. The way excess charges work is how the provider is contracted. So your doctor is contracted with Medicare. If the doctor accepts Medicare assignment, then they agree to accept whatever Medicare pays them as payment in full. If they only accept Medicare but not assignment, then they take what Medicare pays them, and then they can charge you 15% on top of that, which again, it's not a whole lot for the most part. So if it were a $100 office visit and you had to pay an extra $15, it's just something to really understand. And again, if the premium is low enough, it'll make sense to take a strong look at it. So just make sure you understand excess charges. And again, I can go over that in much more detail with you if you want to give me a call or send me an email. So Plan N is absolutely a great choice if the premium is more than $25 less than Plan G. So if it's not $25 less than G, I'm probably picking G. But if it is more than 25, then N makes a strong choice. So that gives you a pretty good overview of Plan N. Looks like we did pretty good on time. And again, I'm happy to help with any of this, and there's no cost for you to use me to help you. So hopefully you'll allow me to help you. Just give me a call, send me an email, visit Medicare on Video. You can get a quote very easily, very quickly. No cost, no obligation. Happy to help with any of it. Hope you have a fantastic day.